Welcome back to another edition of Brainwaves this Thursday. I'm Jim Sigler. So I've been thinking, practically every episode we've done on Brainwaves has to do with the practice of medicine. How to manage Guillain-Barré syndrome, how you think about the worst headache of life, and so on. And that's been the purpose of the podcast, to provide a more unique approach to medical education, especially in neurology. And these episodes, I hope, should help you in your practice of medicine. But that's not all being a doctor is about. And if you maintain that perspective long enough, you can forget why you chose your profession, why you practice medicine. So, today, in place of another episode on the practice of medicine, today you'll be hearing about the experience of medicine, from the perspective of a patient, about how they perceive disorders of the nervous system.
It's just the most interesting organ ever, though. You never bloody, understand it properly. I'm going to have to try not to swear.
This episode was brought to you in part by Audible. With nearly 200,000 ad-free audiobooks, I'm sure you'll find something you'd like. I recommend Brain on Fire by Susanna Cahalan. It's the story of a Washington Post reporter who describes in vivid detail her battle with anti-NMDA receptor encephalitis. To hear this book and get your free 30-day trial, go to audibletrial.com/brainwaves and sign up. The first month is free and less than $15 a month for each subsequent month, with no cancellation fees. So take a minute to sign up for free at audibletrial.com/brainwaves.
Hello.
Hey, Torie.
Hey, how are you?
I'm good. How are you doing?
I'm good, thanks. Yeah, it's 8 p.m. here. What time is it your side?
This is Torie Robinson. On rounds, you might hear about her like this. Miss Robinson is a 36-year-old female with a history of drug-resistant localization-related epilepsy since age 10 who returns with recurrent seizures despite therapeutic anti-epileptic drug levels, an unremarkable brain MRI, exam findings. But today, she's Torie. Just Torie.
I love the piano. I started again after about, I think about 18 years break, and it's wonderful.
Perhaps more relevant to Torie's social history, besides her musical interests, is that she's from London, and she runs her own business in social media marketing called Media Evolution. Not to mention that she's suffered from epilepsy for as long as she can remember.
Because I always remember myself as having epilepsy. In fact, it wasn't diagnosed until I was 10.
And I'm including this in her social history, and not just her medical history, for a lot of reasons that we'll be discussing today.
I just remember having what I used to call these funny feelings in inverted commas. My parents didn't even notice for years. And then they're like, dude, you're looking a bit weird. So they took me to the doctor and I got diagnosed then.
She's made it something of a mission to educate others about epilepsy and all the psychosocial baggage that accompanies it. Which is why I've asked her to join me on the show. Torie works with Epilepsy Action, which is the largest epilepsy charity in the UK, and together they've worked to raise awareness about epilepsy, and to support research and reduce discrimination among patients with epilepsy. Just last year, she received the Media Volunteer of the Year award for her contributions. And I met Torie on Twitter a few months ago. She found out about the Brainwaves podcast there, and being the incredible advocate that she is, she wanted to know how she could become involved, or even share her story with others.
So they were very mild when I was little, so I was very lucky back then. And they did do an EEG, but of course, given it was just an EEG, it didn't show anything up. But they just diagnosed it from the description. The main one I remember, I must have been about 6 or 7, and I remember I was at school and we just had PE or sport, and I was getting changed and I almost walked back into the classroom in just my underwear, and then I was like, oh dude, okay, and then I turned around and it's because I just had an absence.
So you literally almost lived out my worst nightmare, which is going into school naked.
Yeah, I'm sure some people wouldn't have minded, but no, it wasn't my idea of a good time, and yeah.
No, that has literally been one of my biggest fears when I was growing up. I still have nightmares about that, coming into work naked.
Apparently that's a common nightmare that people have, that they're...
Yeah. Yeah, well, you almost lived that out. So it's interesting because you had the EEG and the EEG didn't show anything, and once your EEG was negative, what was the next step for you?
Honestly, it was just like, try some sodium valproate and get on with it.
So they empirically treated you for seizures?
Yeah, they just said, well, your description is of a stereotypical absence seizure, and therefore we are going to diagnose you, and there you go. And that was it for a good while. Just sort of going back one step, apparently it originated, or it's thought that it originated from a febrile convulsion when I was a baby. So apparently that went on for about an hour. And then as I got older, and I suppose I went through puberty, they just got worse, pretty much. They got worse. So I just used to have absences, then I started having partials. Nobody else really noticed that. And then I started having tonic-clonic seizures.
And you would have them while on the sodium valproate?
Oh God, so I was changing a lot. So I've been on sodium valproate, I've been on Keppra. Until about a year and a half ago, I was on phenytoin. And now I'm on lamotrigine and lacosamide. I wouldn't say that I felt like I was experimented on, but I felt like it was pick and mix, like they just didn't really know what they're doing. And one of my neurologists, I couldn't stand her. She was horrible. And she just used to fob me off and just say, well, get on with it. Because the thing is, you know, when you're growing up and you're a moody teen and you go and forget your meds, and you know this happens and it's not an excuse. But for instance, she would say to me, well, dude, you know, you've gone and forgotten your medication, so therefore we're not changing anything. Okay, whatever. And the older I got, it just became worse. So what brought them on for me was stress, exhaustion, and do you know what? Even if I got too excited, and obviously this got really depressing, because if I got very happy, then that could bring on a seizure, and if I got very upset, that could bring a seizure.
So happiness caused you seizures?
Yeah.
Oh, that's awful.
Very occasionally. So I would get ultra excited. You mean you can imagine like a little 2-year-old going, ooh! And it could cause me to have a seizure, which was nuts. It kind of came together. And
you can imagine how jarring this would be, especially for a young person to realize that triggers like extreme happiness could lower her seizure threshold. I mean, her whole life had to revolve around her epilepsy diagnosis. Nearly anything could increase her chances of having another seizure. Late night slumber party with friends could mean seizure. A stressful school assignment, seizure. A really great joke could probably end in seizure.
Evolution is the word behind it. When I was at work, anyway, I had a big full-on tonic-clonic, and I woke up on the floor, and I have no recollection at all. I'd literally smashed my left clavicle into pieces, bath, and I woke up on the floor. I fell on a railway line once. I need 2 operations on that one. Completely starkers, naked, with blood all around, bashed my head on the floor. Giving myself a nosebleed. Luckily, just a nosebleed. So I've got a cool scar now. Yeah, that was a good stunt, huh?
But having epilepsy doesn't just mean to have seizures, or taking pills, or trying to avoid head injury. I mean, it is that, but there's more. You are also functionally restricted.
Okay, so I've never driven, obviously.
No driving, no swimming in pools, no bathtubs, no cooking over an open flame without supervision. And you would probably be afraid to cross the street alone, much less take on a more exciting career.
I wanted to be a pilot because that was in my family. Couldn't do that.
Nope, can't be a pilot.
So all the main things that I wanted to do, I couldn't. I even considered being a hairdresser for a while, but even that was difficult because you don't fancy someone stabbing you with some scissors.
Well, that makes sense. And Torie also thought about becoming a doctor or a dentist. She even applied for a course in nursing to get her nursing degree, but those weren't in the cards for her either. She felt as if her medications, or her seizures, or both, they kept her in a mental fog that prevented her from pursuing many of her career interests. But it's not just the physical limitations that keep someone with epilepsy from doing what they want.
In my family, many of them like surgeons, doctors, scientists, all that type of thing. And it's always something I wanted to do because I have such a passion for science. But it was never going to sort of happen because I wasn't able to apply myself in that way. Or do you know what? I didn't believe I could because I was believed to be a failure. So I did drop out of university because I wasn't ready emotionally for that and I didn't know what I wanted to do. And
so there's a lot of real emotional baggage that comes with the diagnosis of epilepsy, or for nearly any other chronic neurologic or medical diagnosis for that matter. And I can't tell you how many patients I've seen with a seizure disorder, but to truly talk with somebody who lives with this kind of condition on a day-to-day basis, I've got to say it was really sobering. And I never really get the chance to ask my own patients what it feels like when they're told that they have a diagnosis of epilepsy. I mean, what would you say if your doctor said, "You have epilepsy," and then they just asked you? How does that make you feel? But Torie was extremely generous in describing her experience with it.
It was isolating. No one to talk to about it. It's like I was a pill machine. And at the same time, and this is completely bad luck, but so my parents split up at the same time, and being the eldest child and within a interesting household, having all of that happen at the same time was really painful and quite traumatic. And I used to be pretty bright at school. I was doing pretty well. And then as soon as I was on meds, I tell you, it's like it's overnight. I was so tired. My concentration levels went down, but there's nothing I can do about it. Because being told that first of all, you've got a dodgy brain, and then being told inadvertently that, actually, I don't believe you've got a dodgy brain, you're just being lazy. And actually that's one of the big things, actually, because apart from being a teenager when you're knackered anyway, I was just told that I was lazy. But in fact, upon reflection, it was the seizures and it was the drugs and then puberty on top of that. And despite that being, 20 years ago, it's still sort of part of who you are when you're growing up. That forms part of your personality as an adult, doesn't it?
This was obviously a major theme in our discussion. How having epilepsy made her something of an outcast. Either because of the way she was recognized in the community, in her workplace, by her peers, or because there was literally nowhere for her to go. No support groups, no resources, no outlet. Nothing. And this left her with two choices. A, she could sweep her condition under a rug and ignore it. Maybe it'll get better, maybe it won't. But at least she wouldn't have to spend all her time thinking about it. Or B, she could discuss it openly. She could raise awareness and bring people together to face their disease. Naturally, Torie chose the latter.
And so I would tell employers, I would tell my new friends, I would tell potential partners, everything. And I actually found it was a really good test of personality. So if somebody behaved in a discriminatory manner or they were a bit afraid by it, if they were discriminating, I'd be like, well, I'm not interested in you anyway. And if they were a bit afraid, then I would use it as an opportunity to give them information and educate them. And it actually seemed to earn me quite a bit of respect with some people because most people don't seem to be open about it.
You were on a mission.
I am, and that's why I work with Epilepsy Action over here. And I'm very open about it now.
It almost surprised me how open Torie was about her condition with family, friends, and coworkers. She even brought up her condition on first dates.
I did, because if people were going to judge, then I wasn't interested anyway.
She had no fear of judgment or discrimination, which patients with epilepsy are 7 times more likely to experience than other people their own age.
When people discriminate against those with epilepsy, it's like discriminating because you're gay or because, you're blonde and not brunette or something. It's
outside of your control.
Exactly. Yeah. I can't do anything about it. And it's never ever going to go away.
It's never ever going to go away. And that's the mentality that people have with epilepsy. Even with the best medications out there, you can still have seizures. And you probably will. But for some patients with epilepsy, there's more to treatment than pills. For some, there's surgery. Brain surgery. And after decades of dealing with her condition, trying different medications, and hopelessly avoiding seizure triggers, Torie met a neurologist who felt she would be a great surgical candidate. Then one day, a call came.
So, it's actually very last minute because I was on the waiting list and then somebody pulled out because they got unwell and they called me the day before and said, do you want to come in? I'm like, yeah, dude, let's do it. Well, I spoke to work just to check, not that they could really say no, but and they were fine with it. So I went in and I tell you, I was so excited. I will not be afraid of anything like this. I had seen, operations on telly or online and stuff, and I just wanted to get this skanky bit of brain out of my head.
Sure.
So I put on that, that sexy nightie, and and they shaved 7 pieces of my hair off, and just the main bit on the left side of my temporal lobe. So I still had quite a lot left, but it looks so funny. And then I remember waking up.
That was 4 years ago. And for those of you who are thinking, really? Surgery for epilepsy? Well, yeah, actually. And for those of you who aren't so neurologically oriented, I apologize in advance for some of this science talk, but we're going to take a quick tangent and talk about epilepsy surgery. Not only is epilepsy brain surgery an excellent option for many epileptic patients who have surgically accessible cortical lesions, but it turns out that patients with temporal lobe epilepsy, patients like Torie, they do really well if most of that temporal lobe is resected. In the landmark trial by Wiebe and colleagues in 2001, the patients with localization-related epilepsy affecting the temporal lobes had a significantly lower rate of seizure recurrence, and they were much less likely to require antiepileptic drug therapy if those patients underwent temporal lobectomy. 1 year postoperatively, nearly 60% of patients in the surgical arm had any recurrent seizures that affected their consciousness. In contrast, only 8% of patients in the medical arm did this well. And obviously this had dramatic consequences for quality of life. And since this trial, we know patients who are amenable to this type of procedure are happier, they feel less anxiety, and they're more likely to get back to doing the things that they hadn't been able to do before. Things like driving a car. But let's see how surgery affected Torie.
So since the op anyway, I've only had, I think, 2 tonic clonics. I'm having about 1 a year, which is pretty amazing.
1 seizure a year. That's incredible. Compared to her pre-operative state, when Torie would have 1 to 2 seizures like that a month, that's been cut down to just 1 a year.
That, to me, that is, the surgery has worked big time.
Just like we've seen in the major clinical trials for epilepsy surgery. Not to mention, the surgery also elevated her mood, it improved her attention, and it made her less sleepy throughout the day. But it wouldn't have happened if she hadn't connected with a neurologist who knew the latest in the literature. Or maybe it would have happened earlier if she had hooked up with a support group, if there had only been a support group for her at the time. But there wasn't. And now that there are groups out there like Epilepsy Action, and there are resources for patients and ways to crowdsource medical opinions, which we talked about back in episode 60, maybe these kinds of outlets will open the dialogue between the patient and their provider about surgical options. That being said, there are reports out there that surgery referral rates for epilepsy are unchanged. And despite this growing knowledge in the literature about the success of surgery for epilepsy, it turns out that referral rates for refractory epilepsy are not changed in the past couple of years. It makes you wonder, why is this rate not rising? Perhaps most surprising is that 90% of neurologists have reported that they know the indications for epilepsy surgery, and yet fewer than 2% of patients who could benefit from epilepsy surgery actually get the surgery. 2%. That's like seeing 50 patients who come in with severe migraines and saying, well, you all have migraines, but we're only going to treat one of you today. So how can we fix this? How can we open this dialogue between the patients and their providers about this life-altering treatment? How can we better support our epilepsy patients, not just pharmacologically, but also mentally and emotionally? And what can the patient do?
I would say they need to find somebody else who they can talk to in the way that I'm talking to you, or you talk to your patients. All you need is someone to talk to say, do you know what, this is how I feel about it. Not just these are the seizures, but this is how it's making me feel. Because then you'll realize you're not alone, and it doesn't make you weird, it makes you interesting.
So there's a lot more ground we need to cover, and a long way to go to eliminate these psychosocial barriers faced by our patients. We should be working harder to raise awareness about the cognitive, economic, and the social side effects of our diseases, and our therapies. And where possible, we should be looking into these options, things like surgery for particular patients with refractory epilepsy. And just to be perfectly clear for the neurology listeners out there, the appropriate candidate for surgery and the patient most likely to benefit from brain surgery with epilepsy would be one of the following. First, a patient who has a focal brain lesion, or at least if no brain lesion, then an EEG or PET scan with features suggesting a localized temporal-lobe epilepsy source. Or 2, a patient who has mesial temporal sclerosis on MRI. And sure, there are a lot of other positive prognostic criteria that have been validated, but those 2 are basically it. These patients can do better, and I know that we can do better than 2%. People out there like Torie, people who might have wanted to become pilots or nurses or hairstylists, they deserve it. Alright, that wraps it up for Brainwaves this week. Huge thanks to Torie Robinson for sharing her life story with us. And thanks to all the patients out there who have participated in these major clinical trials showing the safety and the efficacy of surgery for epilepsy. We could not have done it without you. You can learn more about Torie on her new blog at epilepsyisabitch.co.uk, and you can learn more about Epilepsy Action at epilepsy.org.uk. We've posted links to both of these sites on our blog. The episode this week was supported in part by Audible, your source for audiobooks. Go to audibletrial.com/brainwaves to get your free 30-day trial and first free book. We're also supported by Blue Apron, and you can find a $30 discount using our link at brainwaves.me. The episode this week was produced by me, with music courtesy of Andy Cohen, Josh Woodward, and Steve Combs. As always, you can find more information on our website, or follow us on Twitter, or Facebook, or Instagram. I'm Jim Siegler, and we'll talk with you next week.